Hello everyone, I'm Dr. Zhang. I'm from the first affiliated hospital of China Medical University. Today, we will learn stomach meridian of foot Yangming. There are three parts: the course of the meridian, principal indications, and the points of stomach meridian. First, let's see the course of the meridian. The stomach meridian starts from the lateral side of Elanasi. It ascends to the bridge of the nose, where it meets the bladder meridian. Turning downward along the lateral side of the nose, it enters the upper gum. Remerging, it curves round the lips, descends to meet Chengjiang, then it runs posterior laterally across the lower position of the cheek and Daying, winding along the angle of the mandible, 颊车. It ascends in front of the ear and transverse 上关, then it follows the anterior hairline and reaches forehead. There are four branches of the stomach meridian. First, the branch emerging in front of Daying runs downwards to Renying. It goes along the throat and enters the supraclavicular fossa. Descending, it passes through diaphragm, enters stomach, its pertaining organ, and meets spleen. Second, the branch emerging from the supraclavicular fossa runs downward, passing through the nipple. It descends by the umbilicus and enters qi chong on the lateral side of lower abdomen. Third, the branch from the lower orifice of stomach descends inside abdomen and joins the previous portion of the meridian at qi chong, running downward, traversing 闭关, and reaching 腹突, and then the knee. It continues downward along the anterior border of the lateral aspect of tibia, passes through the dorsum of foot and enters the medial side of middle toe. The tibial branch emerges from 3 chun below the knee and enters the lateral side of middle toe. Fourth, the branch from the dorsum of the foot rises from the dorsum and terminates at the middle side of the tip of great toe and comes out at the tip. And then, principal indications. It includes gastrointestinal diseases, diseases of head, face, 5 sense organs, mental diseases, skin diseases, febrile diseases, diseases of the regions along the course of this meridian. Next one, the points of stomach meridian. This meridian appears at Chengqi and goes to Lidui, bilaterally each consisting of 45 acupuncture points, and we will learn 5 of them: 天枢, 梁丘, 独鼻, 足三里, 上巨虚. 天枢, it is front move point. Location, it is 2 chun lateral to umbilicus. Regional anatomy, branches of the 10th intercostal artery and vein, branch of the 10th intercostal nerve. Indications. First, abdominal distension, bulbarygmus, pain around umbilicus, constipation, diarrhea, dysentery. Second, irregular menstruation, mass and gathering in the abdomen, dysmenorrhea, amenorrhea. Needling method, perpendicular insertion from 1.0 to 1.5 寸. 梁丘, it is C-cleft point. Location, when the knee is flexed on the line connecting an anterior superior iliac spine and lower lateral border of patella, 2 寸 above patella. Regional anatomy, the lateral femoral cutaneous nerve. Indications, first, acute gastric pain, acute mastitis. Second, swelling and pain of knee joint, paralysis of weakness of lower extremities. Third, breast abscess and pain. Needling method, perpendicular insertion from 1.0 to 1.2 寸. 犊鼻. Location, when the knee is flexed below patella in the depression lateral to patella ligament. Regional anatomy, arterial and venous network around knee joint, articular branch of common peroneal nerve. Indications, swelling and pain of knee joint, limitation of knee movement, paralysis or weakness of lower extremities. Needling method, oblique insertion toward the medial back from 0.5 to 1.0 寸. 足三里, it is 合系 point, lower 合系 point. Location, 3 寸 below 犊鼻, 1 finger breadth from the anterior crest of tibia. Regional anatomy, anterior tibial artery and vein, the lateral sural-cutaneous nerve, and the cutaneous branch of saphenous nerve, deeper, the deep peroneal nerve. Indications, first, gastric pain, vomiting, dysphagia, abdominal distension, bulburic dysentery, constipation. Second, paralysis or weakness of the lower extremities. Third, depressive psychosis and madness. Fourth, breast abscess and intestinal abscess. Fifth, emaciation due to general deficiency. It is the key point for keeping healthy. Needling method, perpendicular insertion from 1.0 to 2.0 寸. 上巨虚, it is lower 合系 point. Location, it is 6 寸 below 犊鼻, 1 finger breadth from the anterior crest of tibia. Regional anatomy, same as 足三里. Indications, first, bulburic abdominal pain, diarrhea, constipation, intestinal abscess. Second, muscular atrophy, weakness, numbness, and pain of lower extremities. Needling method, perpendicular insertion, 1.0 to 2.0 寸. Okay, this class is over. Thank you. See you next time.